Mr. President, I'm happy to be standing here today on the Senate floor during an exciting week and one that really provides us with hope for the future. I welcome President Biden and, of course, Vice President Harris to their new roles and look forward to their leadership that they will provide in these difficult times. We can never forget that America is still in the midst of a deadly pandemic. Tragically, we've lost over 400,000 Americans. In my state of Illinois, we've seen more than 1 million COVID cases, and 18,398 of my neighbors and friends in Illinois have died due to this deadly virus. As we continue to try to stop the spread of this pandemic, I'm glad that the vaccine rollout has been able to help some in my state. 537,000 people in Illinois have received vaccines. It's refreshing and a long overdue sight to have the President and White House fully engaged in addressing this pandemic with a focus on science and racial equity. On his first day yesterday, President Biden signed several important executive actions, including instituting a mask mandate for all federal facilities and buildings. Secondly, he moved to rejoin the World Health Organization. This was one of the most confounding decisions by the Trump administration. In the midst of a global pandemic, President Trump opted to remove the United States from the World Health Organization, which was focusing on the spread of this pandemic and its impact on nations around the world. And finally, President Biden created an office to coordinate a national response to the pandemic. Today, he is outlining a strong plan to provide a national strategy to liberate us from this threat. I must say that I was disappointed in the transition when first President Trump refused to acknowledge that he'd lost the election, and then his agencies dragged their feet when it came to informing the Biden administration of the status quo in America. Thus, today we learn that we were not as prepared as we should have been when it came to distribute the vaccines that were being manufactured across this country. Now we almost have to start from zero to find a way to meet President Biden's challenge of 100 million Americans vaccinated in the first 100 days that he's in office. I pray that he is successful. We should do everything in our power on both sides of the aisle to give him the resources and the cooperation he needs. The fact sheet of things that will be done by the Biden administration on COVID-19 is lengthy and impressive. The President, on the first day, established a White House COVID-19 response office and coordinator. As I mentioned, required mask wearing and social distancing in federal facilities, and rejoined the World Health Organization. Today, President Biden also unveiled a national strategy to leverage federal resources. It outlines detailed plans for a comprehensive vaccination strategy. If there was cheering, and there should have been, for the Warp Speed project developing successful vaccines in a short period of time, it was followed by some disappointment that even with these vaccines and the knowledge of how to make them, we're not producing them in the quantities necessary, and we're not addressing the logistics of spreading these vaccines across America where they're needed the most. The President is setting out to restore trust by leading with experts for public outreach, and he's relying on science. That is refreshing. It's hard to imagine something that basic is as refreshing as it is. He's providing resources and guidance to reopen most K-8 schools in 100 days. Wouldn't it be a blessing? There isn't a parent or grandparent in this country that won't cheer that particular goal. He's addressing supply gaps in state capacity, and we're finding them virtually all over the United States. And he's focusing on vulnerable populations, including those in long-term care facilities and communities of color. To implement this plan, President Biden will sign executive orders today to direct agencies to exercise all authorities, including the Defense Production Act, to accelerate manufacturing and delivering of vaccination testing, and medical supplies. Let me say I never understood why President Trump refused to use this Defense Production Act to its full capacity, to use his leadership as president, to marshal the resources of production and distribution of vaccines and other absolutely necessary medical devices. President Biden also is directing FEMA to increase federal reimbursement to states from 75% to 100% for emergency supplies such as PPE and National Guard personnel. He's establishing a healthy equity task force to provide recommendations on how to allocate and address racial and ethnic disparities that have been magnified in this crisis. We know the economic damage of this virus continues to linger. Nearly 1 in 4 people in my state in renter households report being behind on rent, and 1 in 3 households report having difficulty just covering usual household expenses. We continue to see historic numbers of Americans filing for unemployment, including more than 100,000 people in Illinois who applied for unemployment last week. But to fully address the health and economic toll of the pandemic, Congress needs to build upon the work we did in December and heed the call of $1.9 trillion plan that President Biden outlined last week. Mr. President, I was part of a bipartisan group of senators that met several months ago and talked about following on the CARES Act with some measure of COVID relief. We proposed a plan of $908 billion, which was then embraced by the leaders on both sides of the aisle and the White House, and they negotiated further. That resulted in the measure we passed just a few days ago. But make no mistake, that was not the end of the story, nor did we envision that it would be. This was done on a temporary emergency basis to cover the first quarter, that is, the first 3 months of this calendar year. I pray that this pandemic and all of the problems it's caused will soon be gone, but I doubt that it'll happen in the next 3 months. We have more work to do, and President Biden knows it. I think we all do. We need to come together again on a bipartisan basis. The first CARES Act passed the Senate by a vote of 96 to nothing. There were no dissenting votes. The second measure, I believe, had 91 or 92 votes in favor of it. So we have shown real bipartisanship. We can't quit on this challenge. Janet Yellen, who has been named as the Treasury Secretary designate by President Biden, had a conversation with her 2 weeks ago, and we talked about the perilous state of the economy. It is naive for us to believe that the worst is behind us. We have to face the reality that we may have darker days ahead, and we've got to be prepared to deal with them. First with the pandemic, and second with the economy. Even the chairman of the Federal Reserve has encouraged us not to take our foot off the accelerator, lest we lapse into a recession or worse. Let's take this seriously. Let's help the businesses, help the workers, help the families, and do our best to get this economy back on its feet. Illinois has spent $843 million in our health departments to expand testing and vaccine delivery from the December package. With 500,000 people vaccinated so far in a state of 13 million, more resources and support are needed. That means providing the $20 billion for vaccine distribution and $50 billion for testing President Biden has asked for as part of his rescue package, so we can finally, once and for all, crush this virus, get the economy back on its feet, and get our kids back in school. It also means investing in the health workforce, such as through a bill I've introduced with Senator Marco Rubio, Republican of Florida, to provide scholarship and loan repayment to the National Health Service Corps for doctors and nurses to serve in communities with a shortage of providers. Mr. President, I'm sure you're personally aware there are fewer African American doctors in the United States today than there were 20 years ago. I'm sorry to report that. It should be just the opposite. We should have so many more for many reasons, not the least of which is to overcome the health inequity. This scholarship program that Senator Rubio and I are proposing builds on the model of the National Health Service Corps, which attracts young doctors to come and serve in underserved areas and to help underserved populations, and then helps pay off their student loans. We take the approach Keep that. It's good. Expand it where we can. But let's look at another aspect. What if we provided scholarship assistance and really directed it toward minority candidates to become doctors and dentists and nurses and healthcare professionals? All those aspects would be encouraged if people knew they had a scholarship through the National Health Service and the promise that they would serve where they were needed after they graduated. We hope this will be included in any measure that's passed in the near future. The President plans to set out additional relief measures that will flow to those in need. I especially am encouraged by making the child tax credit fully refundable. That's going to benefit 1 million kids in my state. This plan aims, the Biden plan aims to safely open schools, businesses, and travel while protecting workers in these areas and committing to protecting our most vulnerable populations. I'm ready to continue pushing for COVID relief. The job isn't finished by any means. We must provide American families and workers the tools they need to survive in this difficult economic time. As Chairman Yellen said earlier this week, without further action, we risk a longer, more painful recession now and longer-term scarring of the economy later. Let's do this, America. Let's do it together. Let's let the spirit of unity that we saw on the west front of the Capitol yesterday bring us together here in the Senate and the House in a joint effort to help the American people with the resources they need to survive this pandemic and this lengthy financial hardship. Mr. President, I yield the floor.